The heart doesn't lie, especially when it comes to your health. The Heart and Stroke Foundation says 30% of South Africans have some form of cardiovascular disease. It's one of the major causes of premature death, especially among 36 to 64-year-olds. And one of the biggest causes of death in the country, even more than all cancers combined. Well, cardiologist, that's Dr. Cupido, joins us now to give us more details about this story that we're talking about, Doc. And I mean, this is not the news that we were hoping to hear. Good morning to you. It is a reality. Something needs to be done about it. Let's talk about the causes of death from, premature death, that is, from cardiovascular disease.
Good morning, and thank you for this opportunity. Yeah, so there are a number of conditions that affect the heart, and it's not really only heart attacks. I think heart attacks probably make up most of the premature deaths in terms of adults. But certainly there are other conditions as well. Heart disease that affects the valves, which can affect younger people and children. Congenital heart disease, as well as other aspects of the heart that can be affected other than the arteries, such as the heart muscle or even the electricity in the heart. The biggest issues, though, that we face that can be prevented is what we call coronary artery disease. And there the risk factors like hypertension, diabetes, obesity, those are the major factors where we can actually do something and try and improve our health from that point of view, from a personal capacity.
Yeah. Are there any symptoms that we need to look out for and take very seriously?
Yeah, so I think the first port of call really is in terms of prevention. So if there is something you can do even before you display any symptoms, is to get your risk factors under control. As I've mentioned, the factors that I've mentioned, hypertension, diabetes, smoking, those are all risk factors that will contribute to you having heart disease in the long run. So those are things you can prevent. When you do have symptoms, especially shortness of breath when you are doing something, when you're exerting yourself, or chest discomfort or chest pain, especially when you are also being active or exerting yourself, those are probably two of the major complaints that we see in the adult population in terms of heart disease.
Yeah, and prevention indeed is better than cure. Hence, I do agree with you, Doc, saying perhaps let's try preventative measures, keeping healthy, so to avoid those symptoms. But worst case scenario, let's say you do have a heart condition. Is there treatment? Is there treatment available?
Sure. So it depends largely on the type of event that you're having. So obviously some things are chronic, and in those cases, people will get to the hospital. They will hopefully have a clinician who's going to be looking after them over a longer time frame. In the event of an acute heart attack, when you are having a heart attack on the spot, the aim is to get to the closest emergency facility as soon as possible in that event. And that is usually accompanied by severe chest pain, usually symptoms like nausea, vomiting, sweating. And in that scenario, you go to the closest hospital where they'll be doing an ECG, and they'll then, based on that, assess what treatment strategy is best for you.
I mean, something that I think personally I might, take for granted is, monitoring my heartbeat. But I understand that's equally important to understand your heartbeat, to monitor it, and know when, something is wrong that you need to consult your doctor for. Am I correct?
Sure. So monitoring heartbeat is such a tricky one, especially with the advent of heart and wrist monitors, because on the one hand, yes, it is good to pick up when something is wrong, and on the other hand, obviously, it's a fine balance between being anxious and nervous, when your heart just once or twice does something funny. So I think one of the important things is, especially in older patients, when you consistently have a heart rate that is under 60 beats a minute when you are not a fit and active person. Obviously, a fit and active person will normally have a slower heart rate, but in patients who are not doing much exercise and who isn't necessarily fit, especially if that slow heart rate is accompanied by symptoms such as dizziness, feeling lightheaded, or even blackouts. In that particular case, very important once again to get to an emergency unit.
All right, well, I appreciate you speaking to us about this and educating us right here on Newslink, Doc. This information is much appreciated. Thank you so much, cardiologist Dr. Cupido, joining us this morning, talking about how your heartbeat is so important for you to monitor, but your heart health equally as important. But we've got